Everyone, and welcome to the Adults and Health Scrutiny panel on this Thursday evening. I just want to welcome you all and to remind everyone that this is being filmed and recorded and will be put out onto the public site so that everyone can not only join us and see what's happening live, but also it'll be out for people to look at a later date. Just so anyone notes, they will be anything they say in the meeting will be picked up and you will be filmed if you're in the meeting. Item 2, apologies for absence.
Yes, apologies for absence received from Councillor Opoku and from Ali Amashali, who's a co-optee. Also, apologies from Councillor Dusnev, the Cabinet Member.
Thank you. Any items of urgent business?
Yes, Chair. So this is an item that should have been included in your main pack, so apologies for this, but it's in your supplementary pack. This is just the standard sort of terms of reference and scrutiny protocol, which you probably will have seen before in previous years, those of you who have been on the committee before. But just out of the papers, just to draw two items to your attention, which are Appendix D, which is the new membership for each of the scrutiny panels for 2023-24. So that's for information just about who's on which panel. And then also on in the main report, 2.1c, which is to approve the non-voting co-opted members for the Adults and Health Scrutiny panel for this year. We haven't had any additional applications, so it's Helena Carnia and Ali Amashali as the proposed two. We have a maximum of 3 that we can appoint to the panel, so there is space for one more if we get any other applications or if anybody wants to make any referrals.
Excellent, thank you. Do we need to agree those now or as part of the?
Yeah, so the terms of reference and so on, protocols are just for noting, but the appointment of co-optees needs to be an agreed motion.
Well, I'm happy to agree our co-optees and the members on the committee.
Agreed.
Agreed? Yep, okay, excellent. Declarations of interest. I always say a member of the RCN and my sister's a GP in Tottenham. Has anyone else got anything they want to put on the record?
Member of the Royal College of Radiologists.
Anyone else? No? Okay. Right, thank you. Going on, deputations.
No, none received, Chair.
Right, so we've got the minutes, which is pages 1 to 12 of the previous meetings. This is in your main agenda pack. So just to draw the panel's attention to this, if there's anything in the minutes they wanted to bring to our attention. No. Okay, so whilst people are looking, so we had on, I think it was brought over from the December minutes, and they're also in these, but also it's on the tracker as well. Just to update the committee that we had as one of our items that on the tracker and as an action for the committee, it was on budget, and it was proposed that dialogue with finance officers about the budget scrutiny papers for next year be commenced in an early stage. I hope you'll be pleased to hear that we've actually begun that process. So that happened on the 19th of June, which involved the discussions of the format of the budget scrutiny papers, particularly in relation now to the capital budget, which is really important that we sort of understand that really well, and also making sure that the information in the report packs are clear for not only the members, but also members of the public to understand, and it's very clear. So that has started as a process. Otherwise, are we happy to agree the minutes?
Agreed.
Agreed. Okay. Right, then we're going to move swiftly on. So I'm just going to ask people in the room to introduce themselves when they come. I'll introduce us as the panel, but for officers in the room, if you are happy to introduce yourselves when it comes to your item, rather than everyone going all at once. So I'm Councillor Pippa Connor. I chair the Adults and Health Scrutiny Committee. Councillor Haran.
Councillor Tyan Curran, Woodside Council Member.
Councillor Sean O'Donovan, Councillor for Tottenham Hale.
Councillor Mary Mason, Councillor for Bounce Green.
Helena Carnia, co-optee.
I'm Dominic O'Brien, Scrutiny Officer.
Okay, thank you. Right, then we're going to move on straight to the dementia service update, which is pages 13 to 22 in your main agenda pack. So, Paul, before you go straight into that with the enthusiasm which I'm sure you're coming into this, and is it Laura? Laura as well. So there's 3 questions that I wanted just to sort of highlight at the beginning of this report, and I think this is followed on from previous dementia scrutiny that we've been looking at in this area. So the 3 questions I really wanted to sort of get an answer to at the end of this report. So what was the budget for the Ageing Well strategy? Who received the money within this budget? So which groups and organisations, and sort of what amounts? Now obviously we're not expecting to the penny, but if you can give us a rough indication, that would be really helpful. And the bit that I didn't get from the papers, but I'm sure you're going to speak to tonight, is the outcomes that were delivered that were measurable. So I understood there's an awful lot in there, but I couldn't see the data or the evidence behind what's in that. So I'm sure we're going to speak to that. So those are my 3 questions. I think at the end of this paper, that would be great if those were really clear. So obviously you're going to speak for a couple of minutes, and then it's to the committee will ask questions. So do you want to sort of a quick overview, yourself and Laura, whoever's going to speak? Thank you.
Thank you, Chair. So thank you for inviting me today. I'm Paul Allen. I'm Head of Integrated Commissioning for Older People in Frailty for NCLICB. So as you can probably gather, kind of dementia is part of my portfolio alongside many others as well. And I'll probably come back to some of the questions that you've just asked me at the end of the kind of the conversation. But the members might recall that we were asked to provide an item, I think, in 2022 about our progress and plans for dementia. So this paper follows up an update around key actions that were included in there as well. And for the sake of helping the panel, I think I get a bit of feedback from, I don't know what that was, sorry. Yeah, is that okay? It seems to have gone now. I don't know whether it was because it was moving around, but yeah. Okay. What we identified a number of actions within the kind of the last report. So this report is largely a kind of a reflection of some of the actions that are within there as kind of actions that we want to take forward. So I'm going to just highlight 1 or 2 of the kind of the areas, and I'm sure my colleagues on the call, Laura and Vicky, will be able to give you a further update around a couple of specific items that we wanted to talk about last time. But it was divided largely into kind of 3 areas. One of which was about improving awareness raising and progress. One of which was about improving the diagnostic rate and the support post-diagnosis. And then the 3rd element was the ongoing support for people with dementia as well. So if I can start with the first one, the awareness raising, there were probably 2 or 3 things we said we were going to do. So we wanted to kind of appoint a dementia coordinator to take forward some of the actions around awareness raising, to relaunch, because one of the purposes of that was to relaunch our dementia-friendly Haringey Alliance for kind of organisations to come together and describe what actions they could take, regardless of what type of organisation that might be, obviously to support people with dementia, also to work with underserved communities and groups, and finally to make sure that people have the knowledge and confidence to kind of work with people with dementia. So we've successfully kind of appointed a dementia coordinator, which is great news. That coordinator's got immediately stuck into the kind of the work, and I'm sure Laura will be able to tell a little bit more about that. But we've kind of relaunched our dementia-friendly Haringey Alliance. We had a really successful conference just last week, I think it was, where we were encouraged kind of organisations to come forward, and I'm sure Laura might say a little bit more about that in a minute. And we've also, part of that role is also to work with underserved communities and groups through our kind of community ambassador network and with other voluntary sector organisations to make sure that we spread awareness around dementia, because that's one of the issues that we face, that not everybody knows what symptoms and signs are of dementia or what to do next if you're worried about your memory and so forth. The other things we've also done, we mentioned it last time, we were developing an Aging Well guide and awareness raising. That's now being shaped, and it's really great that we've now got funding for a training and awareness raising program around Aging Well. As part of that program, we're kind of going to put a specific module in about dementia for those who may be interested in it as well. I think if I can move on, and then we can maybe come back to any of the questions that people have. If I go on to the diagnostic rates, we know that we've been working with our GP practices and NHS Trust to improve the diagnostic rates for people with dementia, because some of it is about getting some of the basics right, about knowing who to turn to get that initial kind of screening, if you like, for people who've got cognitive impairment. But we also wanted to kind of work with and improve the support for people who maybe have early onset dementia. So there are some specific groups around kind of Down syndrome, particularly at risk, for example, of acquiring a dementia at an earlier age. And we also wanted to improve our post-memory service support. So very quickly, what we've done in that space is we're working with individual GP practices. That work has been a little slower than I would have liked, because some of the issues have been, there's been problems in trying to understand the diagnostic rates from our GP systems, which are now resolved, I'm glad to say, but it's taken us a little bit longer to work through the diagnostic rates with primary care than we originally planned. We've now been working really closely with the Dementia Reference Group, who are a group of people with lived experience of dementia, and we've developed a proposal for a dementia charter, which actually describes some of the kind of the things that people might expect in language. Hopefully that's quite accessible to them, because we've kind of co-designed it with it. So it's about knowing where to turn to when you need help, knowing where to go if problems are escalating and so forth as well. And so we're hoping to kind of to work together how to provide the network of support to then launch that charter sometime later this year as well. So that's really positive. And we've been particularly working with some of the GP practices we already know have got kind of a lower level of dementia diagnosis as well, to understand some of the reasons around that, including the data issues. Just finally, I just want to draw your attention to the work we've been doing in care homes, because about 70% of the population who are in care homes have dementia, whether that's mild, moderate or severe. So we've developed an enhanced health and care homes model and collaboration between primary care and community health and the care homes as well, to try and improve the support that's available. That model has been really successful and well received. And it's actually there to manage people who've got kind of, physical health or conditions or issues with dementia as well. We're in the process of extending that to learning disability homes, to go back to what I was saying about there's a group of people who've got learning disabilities who are particularly at risk of having early onset dementia. So the final section I just wanted to kind of mention is some of the key services for people working with dementia. So we've improved some of the kind of support available at our acute trusts through things like an assessment unit for frailty. And that's obviously, there's a number of people within that unit who also have dementia as well. So that's been, again, really quite positively received. And we're in conversations with the memory service at the moment about improving their own diagnostic rates, and also making sure that people have got that better level of support in the community as well, which is now becoming a nice requirement for kind of GPs. So there is also something in the report around kind of describing the hub and satellite model that's being developed. And I don't know, Vicky or Laura, whether you want to say anything about the kind of the different aspects of that. It isn't just about the Haynes Centre, it's also about the other facilities we've got, including the Grace organisation, which has moved into the Iris Centre as well, since the last report. I could be wrong about that. And there's one or two other kind of day opportunities in day clubs, such as the Tom's Club as well. So I don't know, Laura or Vicky, whether you want to say anything specifically around the Haynes Dementia Centre.
Hi everybody, my name is Laura Crouch. I'm the Senior Services Manager in Haringey for Day Opportunities, Community Provisions and Shared Lives. I will work on shortening that title, but for now that's That's who I am. One of the things we're working on with the Haynes is we know the Haynes has been kind of the pinnacle point for dementia in the borough. We're now paired up with places like Priscilla Wakefield House and our other housing associations where they have common room facilities where we can develop dementia friendly activities within those areas. We started that work pre-pandemic and it's something we are now picking back up. So our staff and our dementia coordinator are going out to those groups and we're identifying what the demographic of that community is, not just in the building itself, but in the local population. And then we're developing activities for that population with them to be in those collaborative spaces. So we've got a knitting group, for instance. Priscilla Wakefield's looking at a dementia-friendly drama group and some art therapy groups. So over a period of time, we'll be looking at, the Haynes is kind of your centre of expertise for dementia in the borough, but we want to make sure that that's spider-webbed out into all areas of the community and using these little places with kitchens and places where we can use community gardens to do dementia-friendly gardening are all things that we can set up and have set up previously, and they worked really well. So that's going to be part of the new model. Alongside that, we are looking at expanding Singing for the Brain into the other part of the borough because it's overprescribed now at Alexandra Palace. So we're looking at supporting them to find an appropriate space. We're currently talking to Spurs to see if we can get some community space there to base a secondary Singing for the Brain session because it's so popular and therapeutically it is incredibly effective. We're also talking with Moving Waves and Broadway Brunches. So Broadway Brunches are run by Jackson's Lane, and they have amazing drag acts and cabaret, and they go around to different community provisions. And people with dementia and their carers come along, and they have a good old knees up, lots of food, singing and dancing, arts and crafts. And it is an absolutely wonderful afternoon. We're working with them so we can make sure that they're getting into spaces that they haven't been before, so they're not always in the mainstream places. We're looking at different areas of the borough where we can support them to get into. I've got lots of other things to tell you, but I don't want to go into that bit already.
Thank you, Laura. That's lovely. Thank you. That's given us a flavour of what goes on. So I'm just going to bring us back to the three questions that I started this report with. So when we've been looking at this previously at Scrutiny, we have tried to understand the budget aspect to this because obviously money is tight everywhere. And we're looking to understand how much this Ageing Well strategy budget is. Obviously, there's different aspects as you were talking, Paul, about the acute area, and you're talking about assessments and memory services. I'm assuming the acute hospital settings would be putting money into that area because memory services, I don't know, so you can expand on that, that'll be helpful. But really just understanding what is this budget for this Ageing Well strategy and really trying to understand all these different organisations and groups, and I know there are numerous of them, who is getting what budgets and how do you evaluate that to make sure that that's the best use of the limited money that you guys have to ensure the best outcomes for our residents. So I'm just looking for your evaluation reports, a bit of budget on this. So I'll just open that with you guys, and then I'll open up to the panel for questions on the rest of the report. Thank you.
Okay, so what I would say is the Ageing Well strategy is wider than the dementia input into it. So within the Ageing Well strategy, the dementia side of things is one section amongst many. So there's something there about aging well and about kind of older people as well. There's something there about managing frailty. There's something there about end of life and so forth as well. So the best way to think about it, I always think, is to think about it as a network, and the strategy itself is pulling various parts of that network into the programme. So it's quite difficult to give one single figure to say this is the entirety of the budgets around the Ageing Well strategy because it's a multi-organisational kind of arrangement. What I can say are things like the Better Care Fund plan, which is a budget of about 37 million. A large amount of that funding goes into kind of the ageing well strategy, but isn't just there for 50 plus population, although, as I say, the majority of it probably does hit the kind of 50 plus population. But the Better Care Fund strategy alone isn't the be-all and end-all. So, for example, the assessment unit I referenced earlier around frailty, for example, isn't funded through the Better Care Fund plan. It's funded through acute kind of investment as part of the wider contracts that we've got around it. So answering the question around the total amount of budget is probably not quite straightforward or easy to do. But what I can say is how much money is kind of spent on individual elements within the ageing well strategy. So I mentioned the enhanced health and care homes, for example. There is a finite budget line around the investment in that kind of service, and that's provided by Whittington, for example, as the community health element and by individual GPs as part of the national funding that goes into kind of the GP contracts. So I could pull that information together, but it wouldn't be necessarily fully comprehensive. It would be, a starting point. And what I probably could do is probably indicate, if you wish me to, the kind of the direct investments in a number of our key services within the ageing well strategy, because that's a subject of public record within the Better Care Fund plan. We have to submit in the Health and Wellbeing Board every year. So that's already available. And can I say something about the outcomes as well?
Yeah, no, that's just what I was going to ask you about.
Yeah. So apologies, Councillor. I'm very happy to share some of the outcome metrics that we've kind of established. I just want to give people a flavour of them because, again, thinking about that as a network approach, what we're looking for is the network of services to support people and to lead to some concrete improvements, either for the individual themselves or for the system. So we do some for individual services such as the multi-agency care and coordination team or the enhanced health and care homes team. We've got some statistics around the kind of the number of people engaging, their activities that they're doing, what the outcomes are. Most of those outcomes are based on prior to intervention, post-intervention, for example, but also some wider system impact measures. Now, I don't want to go through how we would do that, but obviously, if, for example, one of our system measures is and it is an important consideration, keeping people home for as long as possible and avoiding crises. But one measure of that is actually, have you been able to reduce the number of times they've gone to hospital as an emergency, either in ED attendances or an admission. So in terms of measurement around that, what I can say, for example, is that since even in the middle of the pandemic, and since the pandemic from 2019, 22, 23, we've seen a 22% reduction in admissions of 65 plus population going into hospital, and about an 8% reduction of people who stay longer than a day. And actually, if you do review some of the analyses around that, what you see is there's no difference between more deprived areas and least deprived areas, which is really something that is quite good news because it means that it's an equitable improvement across all of kind of Haringey, if you like. So we are quite pleased with our progress on that. Is there more that we can do in a variety of different measures? Absolutely. I'm more than happy to share our performance framework for those of you kind of interested in it. What I can't do, sorry, just to finish off just one more sentence, what I can't do today is kind of give you all of the data behind it because some of the work on it had to be suspended during the pandemic. We've picked it up over the last 6 months.
Okay, thank you, Paul. No, it's just because it is a large amount of money, and obviously, as you said, the metrics and how you collect that and the different ways that you're going to do that, we obviously understand there'll be differences, but it is incredibly helpful for us as members to understand if we're putting, say, £4 million into X service for whatever. It's really good to see what changes, what difference that's made to our residents. Because obviously in the next 3 or 4 years, you're going to be re-looking at that as commissioners to see if actually that's the best place for you to put your money. And as part of that, it's really helpful for us to understand the impact on our residents. So I'll leave that there because that's taken up a bit of time. So we'll stop on that part and I'll go to members for the rest of the questions. But yes, as an action, if you could provide that, that'd be really helpful. Thank you. So I'm going to, everyone's got their hand up. So this time I'm just going to start with Councillor Horan and we're just going to go round. So in order, everyone. So if three of you ask questions at a time, that'd be great. Oh, two in twos actually. Thanks.
Thank you. Thank you, Paul. I've got quite a few questions, but I think Councillor Connor's not going to ask me to let me ask all those questions. So maybe just a couple, actually, if you don't mind. I think the first one is about waiting times to get diagnosis from referral to St. Anne's, because I know there are issues around backlog. I know the impacts of delayed diagnosis on residents. I just would like to either some ideas to what it's looking like in terms of time to diagnosis and whether it's improving. So that's the first one. And then the second one is around raising awareness. So I can see there that you've said that you've done some work around raising awareness in underserved communities. Can you give us essentially a little bit more on how you've gone about doing this and actually what impact that has had, real impact, whether there's been essentially an increase in diagnosis of dementia in those communities? Thank you very much.
Okay, thanks, and thanks for all the work that you've been doing, Paul and Laura, and also the dementia coordinator, Claire. I went to the engagement event last week and you had over 60 people there, and it linked into the conference the day afterwards on loneliness with over 100 people, because clearly we don't want people suffering from dementia to be alone, and they shouldn't be alone. And this seems to be work that is not only done from a higher level, but also is also coming from below as well. A lot of community organisations are very much involved in this. And I know there's another engagement on the 27th of July, and I'm sure councillors would be very welcome to come to that. In terms of your the hub and spoke offer that you talk about, there's the Hayes Dementia Centre, which do an incredible work. Obviously, we don't have one of those on the other side of the borough. But we do have, as you've got here, we have other organisations doing incredible work with the people and also with their family. I was wanted to talk about the Grace organisation. Again, I visited them and they do an incredible amount of work with the people that they are involved in, originally coming from a church, but then now they're spreading it wider. In terms of their dementia work, how wide is it that they will spread it? Do people have to be referred to them? In particular, you mention in it, sorry, so it's in another part of the report, but you say that people that used to go to luncheon clubs at the Irish Centre will now be able to go to luncheon clubs in the same venue, but run by the Grace organisation. Now, Sheila knows much better than I do about those luncheon clubs that used to be run for individual elderly people, particularly people from the Irish Centre, but not sorry, Irish community, but not just the Irish community. How is our Grace funded in order to expand that offer, which is a much needed offer? I mean, in the Irish Centre there is facilities for luncheon clubs and other things, and we want to make much more use of it. And just briefly on the equality statement, you talk about groups who better awareness and support from groups that are less likely to come forward, and clearly Afro and Caribbean and Asian groups, and there may well be others, but I think also you might want to add Irish, because there has been evidence that the Irish community, not just locally but nationally, are overrepresented in terms of poor health, including dementia.
Okay, thank you. There's quite a number of questions there, and obviously the rest of the councillors also want to ask their questions as well. So if I could ask you to be sort of quite succinct as well as informative as part of that answer. Thank you. As part of the answers, thank you.
Okay, thank you. I'm just wondered whether, Laura, you might want to take the question about working with underserved communities and groups. I think I did say in the report and talking about it might be a misquote that we're starting that journey. We don't think we've got anywhere near the end of that journey. But Laura, do you want to come in and talk about the work you're doing and intend to do?
Yeah, thank you, Paul. You actually read my mind. My 2 notes I've just written down were underserved communities and the dementia awareness that we're going to be delivering. So we've already identified where the underserved communities are in terms of community groups, and part of the dementia coordinator's role is finding inroads with those groups with their own community leaders, who we're currently going through a process of identifying. We've got identified some already. We've already started like an evening supper club for the Somali community specifically, so we can start talking to the Somali population of the borough about dementia, and providing more awareness and access to services. And there's a number of different communities we will be doing that with over the next year. Part of the way we're going to do that is we are making, rather than doing the traditional Dementia Friends training, we are making a dementia awareness pack specific to the needs of the borough. So where it needs to target specific communities, it will do. We're going to do an LD friendly version with easy reads. We're going to make sure that we have translated versions of the information for those communities. And specifically, we're going to make it based on the demographics of the borough. So we're looking at more people with dual diagnosis, mental health and dementia, LD and dementia, etc. We are working on developing that pack now. So in the next 3 months, we will be looking at starting to deliver that. In terms of the impact that has, to give you a previous example of something we did, pre-pandemic, I was commissioned by Homes for Haringey to deliver dementia-friendly awareness training to the Homes for Haringey team when they were Homes for Haringey. And we managed to get 600 participants to do that training over the course of a number of months. There was an upsurge in referrals from their maintenance staff, workmen and community-faced officers over that period of time, because more and more people had got dementia-friendly awareness training. So we know it works if we can get to the right people, the right officers and the right community leaders. So I'm going to be working really closely with Paul and Claire, the dementia coordinator, to specifically target those areas. And luckily, because I am part of the council, I have access to all of the libraries, obviously all of the councillors for all of your all of the meetings you do. So it's going to be a very proactive process, and it's going to be very much we are going to go into every community group you can think of and deliver sessions which are tailored for them, whether it be for their specific job role and function, or for their community or language barrier, or communication need that I haven't mentioned.
Thank you. Yeah, I wondered as well whether you and Vic, you might want to kind of also comment on the GRACE organisation, because obviously the GRACE is kind of now moved into the Irish Centre, and I think the kind of report talks about their dementia aspects of things. So I think we had a question about, how do people access that centre and what will it do, basically?
Yeah, absolutely. So the GRACE is they're a third-party charity, so they take referrals directly. Social workers, GPs, etc., can refer people into them, the more formal routes. However, people can approach them themselves and do a pay-as-you-go. I know with their luncheon club, before they moved, people could come and pay a nominal fee to be part of that luncheon club. Some people were there benefiting from free meals where they had received influx of food from food banks and different pantries. So I know they've got a number of different networks that help that run. And then in part of the hub and spoke model, the Haynes works alongside the GRACE to make sure that, because they serve not just the dementia community, but a learning disability community, an older community, an isolated community, we're specifically providing guidance around dementia-friendly practices and dementia-friendly activities that can be open to everybody, so that community can be, everyone who's going to that service can enjoy the activities and be stimulated by them, but they're specifically cognitively designed to work with the people with dementia.
Thank you, Laura. And just to finish off, I think one of the final questions that we had in that space was about the memory service. So the memory service is provided by the Mental Health Trust, because once people are kind of identified by the GP as having cognitive impairment, the idea is the GP rules out everything else, like UTIs and so forth, and then there's a formal diagnosis, because it's really important to get the right condition and identified. So there is a waiting list at the minute, and there are, you know, the performance against the timescales for the memory service have decreased up to kind of September time last year. Now, the latest figures I've got suggest that they've made an improvement against the kind of the timescales. I'm trying to recall off the top of my head what that percentage is, and I can't quite do so. But it's still a lot more improvement is needed. So we will. That's definitely an area of focus for the remainder of the year, to try and improve that level of support. One of the things I would reference, though, is the importance of making sure that there is post-diagnostic support, because one of the issues we're facing is the memory service role primarily is to diagnose people with dementia, work out what the initial kind of treatment is, and then move on to the next patient in some ways. They should be confident that the support that's available in the community is sufficient to support individuals. So we really need to build up that post-diagnostic support to allow them to release the patient from their service, if you like, back into the community to be well supported. But because that isn't quite there yet as an offer, I suspect they're holding on to patients a bit longer, but that means that they've got they therefore have capacity issues in responding to the next client, if you like. So there's something to unpick over the next quarter, which we really want to kind of understand. We think there's sufficient resources in the system to enable us to improve the performance back to where it has been pre-pandemic, but it is one of those services that's maybe hasn't fully recovered from it to its pre-pandemic level, and it's something that we really need to get into the guts of in 23-24.
Okay, thank you. So we've got the next two sets of councillors, so Councillor Mason and then Councillor Brennan, and then we've got Helena and Councillor Peacock. So yes, over to you guys.
Great, thanks very much indeed, and thanks a lot for the information you've given us so far. It sounds a lot of good, exciting things happening. There's a couple of areas that I wanted to particularly ask about, and I'm really pleased to see the focus on prevention and early intervention, and also the ongoing focus on that, because surely, you know, I understand that what we're trying to do is to keep people at home for as long as possible, and so that they're not moving into residential care if possible. One of the things that has been raised with me as a councillor locally is carer support and how difficult carers find it. In my kind of work life, professional work life, I've also, which isn't domestic abuse, I have had cases where, very sadly, somebody with dementia has either killed or been killed by a carer. And I'm not flagging that as a big frightening thing, but one of the things when we delved into that was that the support for the carers was not there. I'm not saying in Haringey, but the support for the carers wasn't there. And so I'm particularly anxious to make sure that carers do get the support that they need, which will in turn obviously help the whole service, because it means that there'll be more time at home, less time in residential care. So that's the first thing, is making sure that we've got that and that it's fairly local. Because a lot of the people that we work with, I mean, Bounds Green, a lot of those people don't have a lot of money, don't have the resources to get to Tottenham or to get to Hornsey, both of which are fairly difficult from Bounds Green would agree that area. So that's number one. And number two, I just want to flag when we're talking about underserved communities, that we have an awareness that one of the biggest underserved communities are working class people, people without money and resources, and that we also factor in the fact that there are groups of people who don't have, not just don't have the resources, but find it quite difficult to access those resources for a number of different reasons. And so I'm keen in Bounds Green, and I'm sure other councils are keen, that we have local facilities, that despite the fact that we don't have a community centre of any kind in Bounds Green, or a community hub of any kind in Bounds Green, that there are facilities locally so that carers can get the support they need in order to support their loved ones. So that's just kind of flagging up a couple of different issues.
Thank you, Councillor Mason. If you just, excellent questions. And we've got Councillor Brennan, if you ask yours.
Hi. So thank you for the presentation, and I think we're doing a lot of good work. So I was thinking of the Haynes Centre, and I've had complaints, strangely, from residents who say that there are no facilities in the east of the ward, and from residents saying there are no facilities in the west of the ward. So, which is obviously contradictory. And I just want to know, have we got concrete plans to actually do an even bigger? I see that we're doing the smaller centres and we're doing a lot of good work in Tottenham, but are we actually going to do a really state-of-the-art, fundamentally wonderful centre in Tottenham as well as the Haynes?
Over to you, Paul.
Okay, I'm going to say something about kind of safeguarding carers in a second, but I wondered whether, again, Vicky or Beverly might want to comment on the east of the borough, and also the kind of the question around the local carer support, because I think there's maybe some news around that, isn't there?
So, good evening everybody, Vicky Murphy, Service Director for Adult Social Care. I'm going to answer the question around carer support and difficult to get support, what is available, and then I'm going to pass back to Laura for the day centre in this area, because she's doing an awful lot of work, as you can see, about really taking that to a different level. So the carers support, from a statutory position, we do have a carers offer under the Care Act, and we do offer that support to carers. And there is a fee that somebody can get, a small budget that people can get to help and support. So we do include that in part of our Care Act assessment, or separate. This year, it was last week, the week before, it was the week of the carer, and this year under ADAS and the president of ADAS, it's Carers Year. So we're specifically focusing on how we can really strengthen our carers offer in our communities. So alongside the work we're doing with localities, and that's taking people back into communities from a social work perspective across East, West and Mid, thinking about how can we really be right in the centre of our communities. We're going to build some carers offer within that, and we've separated some funding to support carers to really think about how we can strengthen our offer, but a bespoke offer across each area on what carers may feel would meet their needs best. So John is actually sat here, which is really lucky, because he has been working alongside of Chris, our PSW, who was on the call. They're working collectively together to look at going out into the community, setting some groups up, and what do you really need and how we can make that work. Really exciting, actually, for the next year. So I'm going to pass to Laura for the next question. Thank you.
Thanks, Vicky. Just to the councillor that was saying about not having a hub or spoke in Bounds Green, I don't know if Cherry Tree House comes under your remit, but we're actually working with Truro Road. We're working with the manager there to develop a dementia-friendly cafe. I'm hoping that's close enough to Bounds Green for that to count. In terms of sorry, that was the carers. Sorry, what was the question? I've got lost now. We've done carer support. My apologies.
Yeah, Laura, it was just about the support that might be available in the east of the borough, and whether there's an equivalent offer emerging for dementia, I think.
Oh, okay, yeah. So that is part of our kind of hub and spoke model development from kind of my side right now, is identifying other places we can get into where we can develop activities in more localised communities, and where we've got really established groups is promoting them to go into the east of the borough as well. And we have a really well established carer support group at the Haynes, and they've actually specifically asked if we can float it around so we can meet the needs of more people. So we're looking at other partners we can work with to move it from month to month across the borough so we can collectively support more people.
So I'm just going to check. I think I got a bit lost. Sorry, on the offer for sort of the Eastern Bounds Green. Is what you were saying is that there is in development, which John is looking to do at the moment, a more localised approach to care. John, could you just sort of add a little bit extra? Sorry, Laura, just to give us that extra layer to that. Thank you.
Yeah, I mean, what we're intending to do in this financial year is to kind of spend the full additional amount of BCF, which is over 200,000. But obviously, we want to make sure that we're kind of responding to the needs of carers. So what we want to do from a locality point of view is come out and kind of talk through, carer cafes, etc., to get a sense of what's really important. We know that, kind of advice and support's always one of the top things, but I'm sure there are other things that our carers in Haringey would really welcome to strengthen that offer. So it's really putting our carers in control of, commissioning what they see as really important to them. So that's the approach we're taking. So our kind of adult social care, social workers and commissioning will be working together.
Can I jump back in quite quickly? Thanks a lot for that, and that's really helpful, and really like the way forward. The thing that I suppose is one about consultation with carers, which you've suggested, John, that there will be, and secondly, that there is a look at what support there is in the locality, so that people are able to access that, which you're talking about. One of the places, of course, that everybody goes to is the GP service. And so where we haven't got, like Cherry Tree is a care home in Haringey, and if outsiders are able to go in there for what you're setting up, then that would be great to know about. But in terms of where everybody's going, it's to the GPs, and where there's a community room at the GP service, then I'd just like to flag that as a possibility, if that's okay. The other thing I think about carers is wanting support from each other. Because, of course, you better understand what's happened to you by talking to other people who are in the same position, and that can relieve some of the weight. And then people start to mix and socialise and talk to each other outside. So I'm sure you know all this, but just the strength of that is so powerful. But thanks a lot for all the work, and that sounds great. Thank you.
Thank you to Councillor Mason and Councillor Brennan for those questions. So just to sort of from the committee's perspective, it's really coming back, and I know we're going to go on to commissioning later. Beverly, I'll call you in just a second. But it was just to say about, it would be really great to hear maybe that as an example of how that's going to work with our local communities in listening to them and commissioning. And I think that's really exciting, and I think that could be a really great action from today. Beverly, to you, and then I must bring in Helena and Councillor Peacock. Thank you.
Thank you very much. I'll be very quick. Beverly Tarker, Director, Adults, Health and Communities, and also ADAS President for this year. And it's in that vein that I just really wanted to build on what Vicky has said. I've spent the day in Westminster actually talking about this issue around support for carers. It is my top priority that I've identified as President of ADAS in terms of support for unpaid carers. We know the significant contribution that unpaid carers actually give to the whole sort of economy and the work that we do and the workforce challenges, etc. And one of the things that we're working on from the ADAS perspective is a challenge to all local authorities nationally to develop a response to support unpaid carers that is in addition to what they're already doing. And I'm really pleased. Once I had that conversation with Vicky, she very quickly responded. So what you've been hearing is part of that response about how we can enhance. And you're absolutely right, it's about how we go about it. We have to work alongside carers themselves so that they can identify what's important to them. The money is finite, it's not an open book. We will continue conversations with central government around carers support funding. We have been promised 25 million nationally. We're still awaiting that announcement from the reform funding. We'll come to that later in today's events, but I think it's really important just to let you know that this is a real priority nationally. Thank you.
Great, Helena and Councillor Peacock, last but not least.
Certainly not least. I've got two questions, Paul. Might not both be yours, actually. The first one is around the fact that the families of people with dementia, and sometimes even the actual dementia sufferers, don't get a lot of input, I think, to help them financially. And information about where to look for help and whether they're entitled to help. And I'm wondering if you're going down that route at all, because, for instance, I understand that certain types of dementia can be funded in social care and others can't. Parkinson's, for instance, does. Alzheimer's isn't. And it's a maze for people that are outside. You know what you're doing, they don't. So I would really like to understand if you've got any plans, especially in these straitened times, to help families about where to look for that kind of help. My other question is completely different, but was triggered by Mary's, actually, which was to try and understand where you are with carers' assessments, because I seem to remember there was a huge backlog. And if you are looking after somebody with dementia, the last thing you need is for your application to be taking months. So those are my two. Thank you.
Councillor Peacock.
Mine is not too, surprise. I don't know if any of you are aware, but I know quite a lot about dementia. On Wednesday morning, I take someone with dementia to singing at the Park Theatre. No one's mentioned that, but that is actually very good and actually has more people attending than attends at Ali Pali. And that's because they come on Zoom. So Priscilla Wakefield, if they can't attend the meeting, they Zoom in. And also Lorenco House Zooms in. Lennox House Zooms in. And the rest of them, we have quite a lot. Big contingent coming every Wednesday morning when I take somebody there. I also take him swimming. Now, we don't do swimming in the borough, so I have to take him to Barnet, to Finchley Lido, where they lay on swimming for people with dementia. And I've now got half a dozen people going there. Luckily, I don't have to pick them all up. I just have to pick up one person and take them there. And then I take him to singing in the Brain for Ali Pali, because I used to be involved with it when it was at the Irish Centre, which, as you know, I was part running it all. And I'd be very disappointed if you do move it away from there, because it has excellent parking, so lots of people can park up there for free and attend, and it's on the ground floor. I've just come from a meeting at Spurs, which was horrendous to find the room that we were allocated, and I walked from one part of the stadium to the other, and I was absolutely exhausted by the time, and thankfully somebody else turned up, so I was able to leave, and I said to them they can do the awards. Now, I also attend dementia meetings at the Phoenix. You've not mentioned that. And I'm an ambassador for dementia from the Phoenix. Many years ago, you closed down 2 centres that used to be for dementia. One is still empty, which is in White Hart Lane. And I'd like to know if you're going to reopen that. I often go to the carers one, which is next door to the park swimming pool. And that's run by Susan Hessel, which is also not council. But for a while I was going there and ended up getting lots and lots of casework. So I thought, perhaps some other councillors should go instead of me all the time. I said, I don't want you to move the dementia thing. And also the Broadway branch. I go to lots of the Broadway branch. And Jessica now works for Homes for Haringey, and she used to run it from the Jackson's Lane. But the problem is, and I've attended lots of them, if you don't go around knocking on doors and practically dragging people out, they don't attend. And I've been to some where there's hardly anybody there. And it's a real shame because they lay on the food and the entertainment and everything. And see, a lot of people, I'm sorry to say this, but when they go into sheltered housing, they're not able to get out and about. They stay in their flat because they're too old or they've got sickness or whatever. There's something wrong and they can't come out. And so lots of people don't come out. I go to the ones in my ward when I was in Northumberland Park all the time. I now go to Sophia House a lot because I was looking after somebody there with dementia who's now passed away and her son was living with them. I'm trying to get him housed. So that's another big problem. Yesterday, I went along to see someone who's had a bad stroke and I've contacted Grace Organisation for him to be able to go there. But what the lady there, who I've known for years, is concerned about, she has no respite. It's very, very tiring looking after someone either who's had a stroke or else really severe dementia. Now, some of the people that go to Alexandra Palace have got dementia where they're not speaking, but others are a different type of dementia. One used to be a counsellor in Haringey Council, and I encouraged her to come along, and she comes along now. But her problem is that she repeats all the time. She'll ask you where do you live, and then 10 minutes later she'll ask you where you live, and then 10 minutes later she'll ask you where you live. So not all dementia is the same, and we've got to learn to realise that. You know, it's all different, and you've got to, you know, the people that I take swimming, for instance, to start off with, the men were frightened to get into the water, and you have to encourage them. So of course I'm in the water as well, helping them to get in, and then I'm helping them to do, but there's no person there to help me, to help them.
So, Councillor Peacock, thank you for that. There's a huge amount within what you've said. So sort of just maybe give it a little bit of sort of bits that you can come back on in particular. I think what you've very well highlighted is the issues when we're talking about asking how we co-produce any new locality places for people with dementia. Actually, as Councillor Peacock has raised, there's a huge amount of variation of need, of variation of support required for that. And I think it's around, and I think this is a challenge back to us as a council, and I'm going to look to you to challenge John, because, you know, if you're coming back to us, but how you capture different people's sort of part of that process. So we don't just literally speak to 2 or 3 people and maybe miss a huge cohort of other people in that. So there's all sorts of things, as Councillor Peacock has raised. So I just wonder if you could maybe give us a little bit of an understanding of how we're going to be able to capture all those sort of different people with their different needs as part of that answer to that question, but also Helena's questions as well. Thank you.
Yeah, I mean, I think we should see commissioning as a vehicle for actually getting the things that people in the communities say they need most. And I think unless we can actually reach everybody and kind of the hard to hear too, you know, we're never going to do that. Now, I'm not saying that we can do it overnight, but we have to start somewhere. And I think our first kind of steps will be to meet some of the established groups and to get a sense from those groups what are the biggest issues for them, but also then look to invite other members of the community and reach right in. And it's that hard to hear group that we really need to hear from. So we're not just going to be looking at those established groups only. It is going to be a case of actually opening it right up and sharing, if you like, where we are in commissioning. I know we're talking about it later, but also how we might shape that commissioning ambition and intention to make sure that we pick up all those things that people are highlighting to us.
I was going to say, and you'll be challenged to hear from people that aren't necessarily overjoyed with the process. We need to hear from the whole range of people, because they often can be very precise at pointing out where improvements. I think, as Councillor Peacock's highlighted a number of those this evening. So Helena's questions, thank you.
Thank you very much. So the families who need help and support financially and their carers, there are multiple ways that we can support people to look at the benefit system or anything they may be entitled to. And that goes right from a social worker doing a social work assessment and referring either to DWP. We also have services in our connected communities that specifically focus on ensuring that people are attracting the right benefits and helping them put those applications in. And again, we've got navigators right across the piece under many disciplines that also can support people in ensuring that they are getting the right benefits in the right way. So there is lots of different ways that we can do that. I'd like to just pick up your point around depending on what your diagnosis is, depends on what funds are available to you. That shouldn't be the point. So how benefits are worked out, and more specifically around things like attendance allowance or DWP extra benefits, is about level of need regardless of diagnosis. So people may have mobility needs that are at 1 or 2 or 3 levels, and the same for those care components. And that's the same for adult social care as well. It's about eligibility criteria and not diagnosis. So if you are, we have got lots of places that I can direct you to if anybody needs help and support with their benefit system. And then I want to go on to carers assessment. I was furiously trying to find the number because we do get reported the numbers and it isn't at hand. But what I will do is I'll post it back later. What I can say is ADAS have just done their spring seminar report. Haringey looks really positive in that report for the number of outstanding assessments, but I haven't actually got the accurate amount. So, but I will ensure that we forward that information later. Thank you.
We're out of time, Councillor Peacock. Is there something? One of the questions wasn't answered.
So respite for the service user or the carer can come in many forms, and it can come through a direct payment or by us facilitating that commissioning piece of work. So now I've been to groups that are particularly focused around setting up some form of respite in a building, having a different old method that we used to have in place and that we no longer have, and John's got that on his radar. So when we start setting up these carers and commissioning strategy pieces of work, you'll be able to take it there. And just to pick up around that, when we go to the locality model, I'm hoping that we can support carers day on day and that we will have a front door service that you can come directly into us. There's another head of service called Caroline Humphreys, who was working with John and working with Chris, and she's trying to reach out to communities around this carers offer in the 3 localities. And we had the same conversation last week. We don't want to go to where we usually go to. How do we get people involved? So if we point 1 or 2 people out, if you could send the message when we're going to initially set up like a carers cafe afternoon where we'll invite people in to really draw down on some of that experience and where we can best meet those needs. Thank you.
Thank you. So some excellent questions there. And thank you again to Paul for coming and Laura for the report and speaking to it. And there's a huge amount going on. And I'm just going to run over very quickly on some of the actions that we've asked for to come back, some recommendations. So the first one was the budget around the Ageing Well strategy and understanding it in relation to the Better Care Fund money. Which organisations and groups are in receipt of that money, and how are these outcomes being delivered and they're monitored and shown that they're working for the residents. There was an area around the action on the memory clinic waiting lists, around getting the figures for that and understanding how that's doing, and the pressures, as you were saying, about the discharging from that memory service and what we're able to do there. And then the last bit I had was particularly to John and colleagues around the carer support and that co-production piece and how that's going to be worked out with lots of different groups, with lots of different needs and in their localities to support people in their local area, as some of the councillors have mentioned today. And bringing in also that whole understanding about this new emphasis on unpaid carers that Beverly was mentioning nationally, and the money, that 200,000 that you mentioned, John, and how that's going to work for us in Haringey. Was there any other actions from that I've missed? Carers assessments. Thank you, Helena. I knew I could rely on your noting there. Excellent. Okay, well, thank you very much. Yep, Councillor Donovan.
I think also maybe clarification about exactly how the Grace organisation are spreading their offer and the support that they've been receiving would be useful to have.
Is that clear? You happy with?
Yes, clear. Yeah.
Thank you. Okay. No other points there. Right. Well, that's for that agenda item. So thank you, Paul and Laura, for that. And I'm assuming John, you're going to be staying on for other items later. So we're going on to agenda item 8, which is the workforce funding and reform agenda, which is on pages 39 to 74 in your supplementary pack. So just turn to it. Right. So we've got 2 sections, I think, to this report. We've got the workforce. Well, this is the bit that I got from it. We've got the workforce part, which is Haringey focused and very much what our offer and how we're looking to support our workforce in this area. And then the second bit, I think, just for members to note, is the local authority assurance document with the new CQC duty, which is on pages 57. And that's a really useful piece to look at, especially on pages 66 to 67, the I statements and the we statements. I think this is a whole new area for us. So again, really helpful that it's in the papers for us as members to be able to understand. So Vicky, I'm going to hand over to you. Is that correct for this?
So we're really lucky tonight to have our principal social worker, Chris Apperton, who is going to talk through the presentation papers to you, and then it'll be open to questions. But absolutely, I have no doubt that I'll have lots of questions that will be able to come in on. So hand over to yourself, Chris. Thank you.
Thank you very much, Vicky, and a very good evening, councillors. My name is Chris Atherton. I'm the Principal Social Worker and Head of Quality Assurance and Development for Adult Social Services. And what I thought I would do is I tried to hopefully it will be helpful to connect the 3 presentations that have been provided. So I'll summarise this in about 5 minutes, and then obviously very happy to take any questions or comments moving on from that. So I'm going to start with social care reform, because essentially that's what CQC falls out from. But there's been a lot of reform that the government has tried to introduce that's now essentially been moved to the side. So a liberty of protection safeguards and the social care cap have been pushed to the next parliament and therefore are unlikely to surface again. And we've also seen changes to the Mental Health Act, which have essentially been pushed back by the committee, which has basically stated that it doesn't do enough to tackle inequalities and rising detention rates. However, the new duty that obviously we were talking about is around the CQC inspection and assurance. And the information of the CQC process has been sort of slowly dripping down to organisations since the end of last year. The plan had been for the CQC to start undertaking its statutory responsibilities around not just local authorities but ICSs as well from April. But I think it's fair to say that that CQC weren't ready to undertake that at that time. So essentially, it's a bit of a staged approach. They're undertaking 5 pilot local authorities between now and September. And then between September and the end of the financial year, they're undertaking another 20 local authorities. And then the aim after that is over a 2-year period for all local authorities to have been inspected and to be rated. Now, what we know so far from the CQC that they've identified 4 themes for local authority assurance. So the first one is around how local authorities work with people, and that looks at assessing needs, supporting people to live healthier lives, and equity in experience and outcomes. The second one is around how local authorities provide support. So that includes market shaping and commissioning. And obviously, John was talking a little bit about that later, but also workforce capacity and capability, integration and partnership working. The third is around how local authorities ensure safety within the system. So a key element of that is around our safeguarding processes and our frameworks, but also reviews, safe systems and continuity of care. And the fourth one, and particularly obviously to members here, is around leadership. So that's governance, management, sustainability, learning, improvement and innovation. And the CQC has 5 standards which form into 5 key questions, which they're calling their key lines of inquiry. And these questions ask about services. Are they safe? Are they effective? Are they caring? Are they responsive to the people's needs? And are they well led? We do know from our work with ADAS and the LGA that recruitment, retention and development of our staff is going to be an area that CQC has a particular focus on. It's obviously it's already identified in that second element of their themes. And what that essentially means for us is that we obviously have had a real focus, therefore, on the redevelopment of our workforce strategy. So the work to date has been to identify the key strategic drivers that relate to our workforce, Haringey as a borough and its connection into the wider system. Now, from this, we've then developed what we see as our workforce priorities, which include staff welfare and well-being, leadership and management, traineeship and apprenticeships, and career pathways. And it's these last 2 points I just wanted to finally touch on in regards to some of the active work we are doing. So professional sustainability is a real issue for all local authorities, because the well, essentially, which we're all pulling from is very shallow. It's very difficult to get the supply that is needed. And that's essentially where we're sort of looking and stating, well, what is it that we need to do internally to develop our own capacity moving forward? And that's essentially led us to the position of where we're sort of looking around, well, and it's not just from a CQC perspective either. Low vacancy rates ensures improved outcomes for residents. It strengthens high levels of service delivery, and it embeds and improves new models of practice. And our new social work and occupational therapy officer roles not only provide stability to our workforce and continuity for our residents, but it also allows us to future-proof our services by ensuring that we have a steady flow of both social workers and occupational therapists coming into the service each year. This will be done by providing staff in these roles a clear pathway into professional qualifications through apprenticeships. So those staff who can demonstrate the right behaviours, values and outcomes for residents will be supported through their respective degrees. This also ensures that workers in our directorate are given a clear career pathway, while also helping to reduce inequalities. These roles are initially being offered to workers in adults, health and communities, but we have the aim to expand across other council departments and then into our local communities, including schools and colleges. So thank you. Hopefully that has summarised those 3 sets of slides, and I'm very happy to take any questions or comments.
Thank you, Chris. Councillor Connors just stepped out. I'm just going to just briefly take over chair. She's asked me, Helena, I think we'll come to you for the first couple of questions. Yes.
Thank you. On the floor again. I did have, one of my questions was really about capacity. I mean, I'm very, very aware of how much time in the NHS this takes when you have a CQC inspection. I mean, we're talking about days of preparation, if not weeks, and people actually doing rehearsals. It goes on. And what I'd like to understand is really how this is going to impact yourselves in social services, because it's not something you've done before. And my understanding is you're quite stretched. How are you going to absorb this, please? I think that's my first question.
So we'll take it in groups of, sorry, Councillor Peacock, did you? No, you haven't. So Helen, did you have a second question? Or I'll ask Councillor Brennan if she's... You can come back. Don't worry. Well,
I'm sorry.
Councillor Brennan, just to see if there's anything you'd like to ask at this point, or do you want to defer? Councillor Mace?
Yeah, hi. Thanks a lot for that. The Obviously, the issue of workforce is a really problematic one, and that's not just in Haringey. We know that it's in London, but nationally as well. And so, I think some of the things that you have put forward look like really sensible, good proposals. I just want to know really where we are at. What is the shortage of staff? What reasons are people leaving for? Is pay a key driver? And are we behind or in front of other local authorities in terms of pay and conditions? And in terms of staff who leave, do we have a breakdown of the reasons they're leaving? And are there any support issues involving that we can put into the mix of the support that we give to staff? So what is the learning from that, and how do we then make sure that we are providing that so that we can retain staff for longer? Because I guess this is going to be our major challenge, isn't it, for all the great ideas we're coming up with, but the major challenge is going to be having staff and what we can do in order to support staff to remain with us. Thank you.
Thank you, Councillor Mason. Helen, I'm going to take your question with with another councillors, because there's quite a lot there for everyone to remember the questions. So I'll come back to you for your second one. Is that okay? You'll get 2 bites at it. So yeah. Great.
Okay, I'm going to answer the first question about how we're going to absorb the CQC work, and I'm sure Beverly might come in around the national context, and then I'm going to pass the second question about workforce initially to Chris, and again I think other people may want to add into that. So you're right, the CQC inspection nationally is a really concern about time and frameworks for people working in adult social care. Some of us sat around this table actually were in post 20 odd years ago, I'm one of them, when CQC did inspect us. So it isn't totally new, but very few people, in fact I bet most people on this row, experience the old way that they used to do it. So some of us may be slightly familiar. And the answer is preparation. And that's why, even though we know that we're not getting inspected this year, the enormity of work that we're preparing and going into to support us to be in that better place. As people know, we've been working along each area. You're going to hear about the commissioning review, which is a big piece of the work that we're doing. We're talking about the workforce review. That's also a big piece of the work that we'll be undertaking. So there's lots of things in there that we've already set up. We've joined the ADAS group for peer review, so we'll get some experience by going to other authorities and for authorities to come to us. We've linked with CQC, and we've got named workers within the authority that their role is specifically around that improvement and that measure that we're going to be undertaking. Personally, I'm quite excited by it because it's really good to get that feedback and that learning about your service, and it supports residents' outcomes. So for me, it is an exciting opportunity, but whilst being embraced in that time consuming. And we are learning from our children's colleagues as well. So they're supporting us with the methodology on the days that people will be coming in to inspect us. So I don't know if anybody wants to add to that bit before I pass to the workforce.
Thanks, Vicky. I think you've said a lot of it. I suppose just to come in and say that ADAS did work very closely with DHSC in terms of the development of the inspection framework. So we're really pleased to see that's going to focus on the I and the we statements, because what that says is that they're actually very interested in people's experience of care and support and the outcomes that people identify for themselves that they wish to have. And that's absolutely in train with the way we see assessment should be going forward. It's, as Vicky has said, it's very much work in progress, and we will get more learning once we have the outcomes of the 5 pilots that have agreed to sort of pilot the experience. But there is significant support out there for all local authorities. Both the LGA, ADAS have been working for some time. We've been involved in self-assessments. I think one of the key things is how well do we know ourselves in terms of how well we are doing? And I think we will be expected to reflect that back on inspection. And obviously there will be areas for improvement. Vicky mentioned earlier the ADAS Spring Survey, which was just launched last week. And if you haven't seen it, I'll be very happy to send you the link. But what that does say is that directors across the country are under a great deal of pressure in terms of demand and responding to need. There is also reflected that the government has been able to give some short-term funding, which has given some improvements, but actually we need to continue to call for more sustainable funding for social care. And I'm sure that in any inspection regime, there will be gaps, there will be areas for improvement. But I believe that we should look at that in a positive light, in the sense of making the case to government and policy people in positions of power, of the need to actually support local authorities in terms of their social care endeavours in improving outcomes for people. So we actually welcome the exercise. I'm not sure I'm as excited as Vicky, but yes, we're very much along the road in terms of our preparation for it. Thank you.
So I've got Councillor O'Donovan, and then I've got Helena's second question, and then I've got Councillor Ingharan, and then Councillor Peacock. Thank you.
Okay, thank you. You've reprofiled a number of vacant social worker positions into social work officer positions, and I can see from the paper that you have recruited some people. How is that going in terms of training? How quickly can you get them onto the job, but obviously with the appropriate training at the same time?
Here we've got Helena. Do you want to ask yours?
Okay, so my second question, I don't know if you've got enough detail yet, but I'm really interested to understand what kind of CQC involvement would be with the carer agencies, because they are a huge interface with the people that actually receive social services care. And so I really, really would like to know what they would see. And I think that a lot of things fall down in that place. Thank you.
Thank you. And just to double check with Councillor Mason's question on the figures around enough staff and the pay, and you had quite a list, didn't you? I'm just checking, was that answered? That's the bit that I thought yes. So I'm just coming back to those three, if that would be. Thank you.
So Chris, can you do the workforce one first, please, and then we'll answer the other two. Thank you.
Yeah, no problem at all, Vicky. In relation to the vacancy rate, so it sits around about 30%, and that's essentially what we're filling with our agency quota at the moment. It is a very challenging picture. There's a number of different reasons why practitioners have left over the last few years, and these aren't just specific to Haringey, as I think the councillor obviously rightly pointed out, but we do exit interviews, and I hold social care forums, so I'm sort of aware of the reasons why people move. I think a lot of the agency workers move outside of London because there's better rates, because we've actually got a pan-London agreement around what we pay agency, and rightly so. And so some people leave because of money, from an agency perspective, that is. So we get a lot of flux with agency. That's something we really don't want to be in. We don't want to be in reliance of agency because it's inconsistent care and support to residents, and we want to have a real stable workforce, and that's one of the reasons why we've looked at the social work officer roles. Pressure certainly has come up. COVID fatigue has come up. A lot of practitioners over COVID put a huge amount in, and actually, and particularly people who've worked in the area for a number of years, some people have decided they don't want to work in the area anymore, want to leave care, and we're seeing that across the system, which is obviously a concern. We've had people who have looked at retirement, people who've sort of talked about work-life balance and sort of have moved further away, and commuting doesn't really work for them anymore. So there's a number of different reasons that have come up. We've recently done surveys with staff to talk around, well, actually, how are you finding your experience? What can we improve on? What would support you more in your roles? What would keep you in your roles? So we're using that information we're getting back from practitioners to, further enhance and improve the offer to our range of frontline practitioners. I've also just recently undertaken 2 audits around support for practitioners and supervision around practitioners. So we're going to go back out and re-enhance the importance of those roles. So from a role perspective, we've sort of identified a need to involve, and that's why we've looked at the social work officer post, because consistency for carers, for residents who are accessing care and support, is absolutely vital. I've been in Haringey myself now for 18 years. I started off as a trainee social worker, and Haringey has done a fantastic job of supporting me through that process. And some of the best workers I've worked with are the ones who aren't qualified and they've never been given the opportunity. And this gives us a great opportunity to move forward with offering and building and developing our workforce. So you were asking, I know the council was asking about how that's going so far. We're in the pilot stage at the moment. We've got 10 roles across mental health, learning disabilities and adult services. What's really come out from the practitioners is how passionate they are about it and how grateful they are for having this opportunity, and they really want to prove themselves. They are undertaking roles already. They're all undertaking assessments, review, support planning, very much in the mould of a social worker, without the level of complexity or risk that a qualified social worker would hold. So far, that's going really well. It's been really positive. We're looking at how we might expand that out. Obviously, this is about developing a clear pathway and career pathways and ensuring we've got a consistency of our own Rowan social workers and occupational therapists with our values, our behaviours, what we want to see from our practitioners who are embedded in our communities, who know our way of working. And that's what we want to, and we've talked a lot about localities. It's a key part of that, and our strengths-based way of working and being embedded and working with community from a co-produced perspective. So we're trying to develop a completely new model, a new workforce that will really be able to drive forward the outcomes that we're looking to achieve for residents. So yeah, it's going really well. We're really pleased with it so far. There's huge scope and opportunity across not just our directorate but the council, and as I said, going into communities and working with residents and giving them the opportunity of being able to step into a career pathway in social care that can lead to the next Beverley as the president of ADAS. So yeah, we're really excited about this as an opportunity and what it can bring.
Could I just quickly, very quickly, I know you're in time,
yeah, thanks.
just really, really quickly. Thank you for that, and that's really useful. I suppose for me, you're doing great work, but there's the risk factor, which is very high if you've got a 30% vacancy rate. It'd be interesting to know, not now, but what the turnover of staff rate is and how we're achieving that stability, and whether it's whether we're going downwards or upwards. So hopefully downwards in the turnover. So yeah, I think it would be good to consistently have a bit of a report on that, given the high risk that it presents to us. But I like your enthusiasm for trying different things. Thank you.
Thank you. Yeah, Vicky.
So I was a social work officer as well before I became qualified, and it's a fantastic opportunity. I'm going to pick up around the 30%. So the corporately we've been given other opportunities. So we are in the process of transferring 6 qualified social workers to permanent posts. So that's probably around 15% of those. So 30% sounds like what we don't have. Reams and reams of social workers. So the corporately we're being supported to transform that around as well, which is fantastic. And the social work officer role will mean that we'll be able to go out into the communities and offer employment opportunities for people with lived experience that perhaps are not able to work 915. We can be really flexible, but we'll draw in the strengths from our communities, which also helps support the economic environment as well. So I think nothing could be better, and we're extending that across to the occupational therapy roles as well for people who are interested in that specific area of work. I just want to come in and back around this question around CQC and carers and what we're doing. So one of the key lines of inquiry is around partnership and co-production. So we will be expected to provide evidence and to work with people differently. So it's a key component that we will be inviting people in, and we will be assessed on it from a CQC perspective. And that includes partners. So ICB, they're also going to be inspected. So that's the partnership relationship, and under the same line of key line inquiries. Now, I have heard under the grapevine that potentially their inspection won't happen until every council in their area has been inspected, but we'll be supporting each other with that process. Thank you.
Okay, so I'm just checking that everyone's questions have been answered, and then I've got Councillor Horan and Councillor, so I can't remember now which order it was in. I know there's Councillor Brennan and Councillor Peacock. You're just going to have to work it out amongst yourselves who put the hands up first, because I can't remember at this point. So Councillor Horan, I think you were next, and then should we just go Councillor Brennan and then?
Thank you, Chris. I'm going to ask a little bit more about your workforce strategy, if you don't mind. I know you've spoken quite a lot, and I understand also a lot of the difficulties that you're facing, because I myself work in healthcare. So I just want to know, in terms of, I think even if you're not able to tell me, maybe this is data that we can get later, is what is the cost of this agency cost, the vacancy, and what is that cost pressure on your budget? Because that's quite fundamental, because it's obviously going to cost more money to hire through agencies. So that'll be one. And then the other is your training provision. Often, actually, to retain staff, you've got to have a plan to train, and not just a plan, but actually funding available to train your staff. I just want to know a little bit more about these things. Thank you.
Councillor Brennan, do you want to ask your question?
So it's really following on from what you've been talking about. It was just your workforce age Christmas tree that you produced. Is it not? It strikes me, just it is worrying that you've got such a the top is the bottom, the older age group is so much wider than the younger age group. So are you able to address that? Can you address that? Do you need to be social workers, have to be experienced before they can be social workers, or are you just stuck with because it looks like that older generation, they're just you're going to lose them.
We'll take those questions, and then we'll go on to Councillor Peacock afterwards. Thank you.
Do you want to come in, Chris, around the staffing first, please?
Yeah, will do. Thank you. So certainly what we've got and the challenges, and you're absolutely right to point out the age demographic, because that has and is an issue. Social work tends to be something that people come into later. It's not something that normally people at sort of 18, 19 go into, but a lot of people have had lived experience, have experience of working in the care sector before stepping into the role. That's not to say, obviously, that people are, in their 50s and 60s when they start becoming social workers, but there certainly is it tends to be an older demographic who are going into that as in employment. We're doing a lot of work with universities at the moment and taking students on placement. We're trying to ensure that we've got a much more robust offer of bringing students into placement and then being able to offer them an opportunities of stepping into the role. So that will help to negate some of that age difference of where it is at the moment. And obviously with the apprenticeships and the trainees, the pathways that we're talking around, so not just stepping into social work officer post, but obviously the apprenticeship opportunities before that, and particularly we're looking at working with the community and people stepping into more of direct support roles within, the services that we have, and then being able to step into different apprenticeships to get to the point of qualification, if that's what people would like to do. So there are different pathways in which we're looking at. The workforce question, I couldn't tell you the cost, what it costs for the agency compared to the permanent. There is obviously a difference to it. It is more costly to be able to have agencies in. Absolutely, we'll be able to get those figures for you. But from a workforce perspective, we have actually what I think is an excellent offer. We have a workforce strategy. We have the opportunity for practitioners to do post-qualifying. So whether that might be specific qualifications around training approved mental health professionals, best interest assessors, practice educators. In actual fact, every single year, for the last 6 years, we've approved every application made by our internal staff to go and develop their career pathways. So every single year, there hasn't been any application that we've turned down at that point. So there is funding there, and we are supporting staff around that pathway. There is then the general training, learning and development offer that we run with staff. Some of that is through commissioned organisations that we bring in and we work very closely with. Some of it is run by myself, some of it is run by our legal team or the individuals in the area that have experts or expertise. We have a really strong working relationship with Community Care Inform and Research and Practice, who have provided some excellent support to our practitioners around with our not just developing our models, but training staff around that as well. So we're quite lucky, actually, I would say, compared to some other boroughs, that actually our budget has remained intact at the amount for the last 5 years, regardless of the cuts. It's not a huge amount of money, but it certainly is significant in what we need to do around training and developing our staff. So I'm really happy with where our workforce budget is, and I think that it really does help to deliver significant change for staff. That is absolutely a key element of making sure that staff want to remain, where you're thinking around their career, their career development, their pathways, and their own learning and knowledge within the work that they're doing. So yeah, hopefully that answers to those questions. I think there was another one, but I wasn't sure which it was.
Before you do that, I'm not sure I had an answer to my second question.
Oh, Helena, can you repeat your second question, and then we'll go on to Councillor Peacock.
Okay, sorry. It was about the CQC process. What kind of interface would they be having with carer agencies, where an awful lot of work is done and an awful lot of complaints, possibly, etc., emanate from? So I just wanted to know about that.
So, and Councillor Peacock, if you ask your question now as well, thank you.
Mine is a very, very short one, you'll be pleased to know, because I noticed on page 105 you say communication across the pieces is an issue. Do you know what communication is an issue with every part of life? In education, when I was a head teacher, people would moan that they're not getting everything. I go to housing meetings, they complain they don't get that. So how do you address all that and put it into language that people can easily assimilate? Communication is really important, and it really upsets people when they say, I didn't know that.
Thank you.
So I've just come back on the CQC and carers. I did mention that one of the key lines of inquiry is around co-production and partners. So it falls into that remit. CQC will be absolutely engaging with carers, engaging with partners, with us in the room, and there'll be a set of questions. So everybody will get the opportunity, if they've been contacted, to feed back in that circle, absolutely. But we will also, we've started just some work with carers and in commissioning as well and setting up groups. So we know that you'll be fully engaged in the process. For the question around yourself, I'm just trying to think how to answer this best. For your question around yourself, I've lost it. Sorry, can you just repeat the question again? Because I've gone.
It's about communications.
Yeah, apologies for that.
And easily assimilated, because it's, you know, you're all very well educated. People out there are not the same level as you, and they don't readily understand some of the reports and stuff like that. So it needs to be put out in easy language that they can quickly gather the information they want.
So we have recently been working more with our comms department, and internally got a comms person that's working directly with adult social care. We also have got our commissioning team that are actually putting comms out and working with providers, carers, commissioners and external stakeholders. We often put things out. I know that we probably need to communicate more effectively, but having a platform to do that. So the website, we've brought somebody in who will update the website and ensure that that has everything on that needs articulating on there. But again, we're going to a locality model. So we will be communicating with you in your communities, right at the heart of what we do. There will be opportunities for residents to come in to those localities and actually talk directly and ask many of questions and get updates from individuals at that point. Thank you.
Okay, thank you. So I'm just going to just sum up, because actually my committee has asked the key questions that I had, so that's excellent. So there's a couple of challenges I'm going to put back. So Chris, around the workforce, we've in the Adults and Health Scrutiny Committee over many years, workforce has come back to us, and we have appreciated the difficulties that you're working in. I think it's really just whether the changes that you're putting in, how well resourced, and you've got the support to, for these apprenticeships. And I think this whole new idea of the support, so the social worker officer and the occupational therapy officer, I think, again, that'll need to be explained to residents as well, because, just so they're understanding who is actually coming in and speaking to them. But actually, it's the support for those undergoing that system. I think that might make quite a difference. But I think really the challenges from the panel is actually the risks that Councillor Mason has particularly highlighted, and really just it'd be really helpful to get a feedback from yourselves, and I think we'll put a date in the diary around how that's going, because I think this is one of the biggest areas in workforce. I think we take pretty much every year, or if not, it's every other year. So I think it's really helpful to know that we're really interested in this as a panel, and really wanting to understand how that's going, and whether you're resourced effectively to deliver what you want to deliver. So that's a bit that I'm putting back. The other bit was around the CQC part of it and the I and the we statements. So that's really interesting for us to understand, and also for residents to understand that this is a whole new process coming up, because they are very used to the council coming in, speaking and asking for their views, and actually just the CQC now coming in and asking for their views. And I think it's how we communicate that. I think communication has been brought up effectively with residents. They understand what they're answering and who it's going to, and what the outcomes of that will be. Because I think for us, a lot of the times we engage with residents and they said, but you didn't implement what we suggested. And it's kind of like, well, actually, this is a whole different, kettle of fish, really, I suppose. And it's really so our residents can understand what they're going to be asked to be engaged in as part of that process. So it's about that education for our residents so they can understand. So really, it's just a sort of a challenge again back to yourselves around how we're going to be able to do that in a way that informs our residents, puts it within a realistic setting, but allows them to engage really well if and when the CQC inspection comes, because there's a lot of quite detailed questions in there that are pertinent to residents.
So I genuinely think the work that we're going to do over the next 12 months, and part of our care interface is embedded within our CQC proposal. So the head of service, Jenny, who previously worked here but has now specifically come back for CQC, has got the plans in place to reach out and start that co-production work for that communication. So we'll be going on the journey, and hopefully members and members of the public, carers, stakeholders will also be going on that journey with us. She set up a series of workshops, and that's where we'll start communicating and start responding and actually working with you on the outcomes that we need to achieve, but also to get your feedback and to learn. And again, I'll bring commissioning in, because the piece of work that commissioning are doing with our stakeholders and with our carers and service users is critical to that piece of work. So we're listening now and we are making those changes. I don't know if you want to add anything more to that, John.
No, I don't think so. I think you've covered it, Vicky. I mean, this is an immense piece of work, isn't it, that we're about to undertake, and it will make a massive difference. I would say that as the commissioner, but it will make a massive difference to people's lives every day, and that's what we're here for. So I'm really excited about it.
Well, thank you. That segues very nicely then onto the next agenda item, which is agenda item 9, which is the commissioning peer review. And under that, there's some very interesting aspects to this report. I think you're not going to be shocked to learn we're going to be particularly maybe asking around page 82, which is the figures that have come out from this this review, and then actually going into a little bit more detail around, again, the sort of the CQC part of that process. So I'm going to hand over to yourself. I think you're leading on this. Alexandra, are you also?
Yeah, I'm happy to support John as and when.
So John, again, sort of just timing wise, over to you, just pick out some key pertinent points you want us as members to hear, and then obviously we'll go straight to questions. Thank you.
Thank you. So maybe just to introduce myself as well, I'm John Tomlinson. I'm the Senior Head of Service for Commissioning, Brokerage and Quality Assurance. It's important, those three bits, because they're all absolutely critical to making sure we get the best possible services with the finite budget we have, as Beverly mentioned, but also making sure that they're high quality and continue to be at a high quality to support our residents. So just very quickly, I mean, you've got a copy of the report, you've also got a copy of some slides. I think it might just be helpful to say where the review came from, because I think it was probably almost a year ago that we took a decision to look at kind of reviewing our commissioning function. It had just become part of adult social care and under Beverly and Vicky. And we felt that it was probably pertinent to just look at how it was operating, not just because of the CQC inspection, but also to make sure that we'd got, if you like, the right approach. And it was a service that would serve Haringey into the 21st century effectively. So we approached the LGA and they suggested that we might want to take part in testing out some methodology and the evaluation tool that we talk about through the Public Service Transformation Academy. Apologies, long kind of sentence there, but we should actually test that out. And there was actually a drive in the LGA to kind of use this tool across the country. So Haringey actually was only the first authority to test it out. So that was quite important. And we give it a good road test, I think we can confirm that. We had 3 days of meeting a range of people, not just professionals, but providers, service users, and kind of voluntary organisations, etc. So it was a wide-ranging review, which involved other members and senior managers across the council. So although we called it a peer review, it wasn't just done by ourselves in adult social care. We had colleagues doing that with us. It's also now been to our departmental management team in adult social care. It's been to Beverly's senior management team and to lead member. So the timeline for this, we actually did the review last September, October. Those 3 days kind of straddled the 2 months. And we've since then been kind of gathering data. And then kind of, partly due to the fact I had long COVID for 2 months, there was a minor delay, and we recruited Alex, who joined me as the project manager. And we drafted the review, and as I say, it's been shared now, and the recommendations kind of approved in terms of direction of travel. The kind of 8 dimensions of the review, you've got them in the pack, so I won't go into detail. I don't think there's any need particularly, but you know, we scored all those component parts. And I think it's fair to say we've got some room for growth, which is really good, because actually we didn't expect there wouldn't be room for growth. There's a lot of challenges out there for commissioning, and you know, we really wanted to be honest with ourselves as well as our key stakeholders in terms of where we're at, and more importantly, how we're going to get to being excellent, because that's our ambition. I'll share Vicky's enthusiasm, Beverly's and Chris's. We're really enthusiastic from a commissioning perspective to drive change and kind of really kind of hit high level quality. So there were a few key messages coming out that we have been working on obviously since the review. One was about strategic direction and just kind of making sure that some of the documentation that we need to kind of guide commissioning, because you know the commissioning cycle requires us to plan. And I think that's a really key dimension before we act and then before we evaluate what we've done. But strategic direction and data were seen as 2 really important things. And we have done a lot of work to make sure we've got some of the documentation, our market position statement, our strategies around learning disabilities, older people, etc., and carers is being refreshed too. Just making sure we've got all those in place. Communication was something, again, I think it's been touched on earlier on, and that's, definitely something that we want to kind of take forward and make sure that we are communicating at different levels, not just that kind of front line working with providers, ensuring there's good quality, but also at a strategic level and making sure that our providers know the direction of travel that Haringey is taking. So there's real opportunities, and as I mentioned earlier, we've got some room for growth in terms of relationships, co-production and innovation. I think you often find that organisations can be a bit reluctant to take risks sometimes. And I think if we're going to really drive commissioning to deliver the services that I think we've heard from, from a carer perspective are really needed, then we're going to have to kind of do some things differently and just challenge the market as it stands maybe and just bring in some new things. So risk for appetite, etc. we're seen as strengths. So there's lots to do, but I think we've got a plan of action. So, I mean, what we wanted to do, and if you've got some models in there, it goes from 1 to 5, or the first to the 5th. And where we're aiming to get to is that user outcome centered, and that's really our direction of travel. All the work that we'll be doing over the next 6 to 12 months will be kind of helping us to measure on that. So, is that okay?
Thank you. I have to say this was a really enlightening report. So I have to say I was impressed by its honesty in its, it's a warts and all report. I'm not going to lie, because it is. So I'm going to ask a difficult question to start with, and I'll open up to the panel to carry on. But I was going to say just at the outset, I do appreciate the fact that this is, in the depth that it's looked at, and it really does highlight the areas that are needed to improve. But also, it's really helpful to understand that now the new direction of travel and the journey you're going to be going on. So on the bottom of page is 91 and coming up to 92 at 1.8. It does point out from this report, it says there's some foundational resources that are lacking within the adult social care commissioning team. So this was obviously previously, which would provide support not only to the commissioning function, but also the teams which engage. And it says these include an overall commissioning strategy, a clear vision about strategic commission, leadership to support the team and its functions, and the contracts register. So we've obviously been commissioning for a large amount of time within Haringey. So why do you think this was lacking to this extent? And this has been highlighted by this report. What do you think were the issues in order that we can learn and ensure that, that things are put in place well, so that, this is addressed? Thank you. And then I'll open it up to the rest of my fellow councillors. Thank you. You might also have some tricky questions.
So just before I bring John in, I'd just like to say that at the point of doing this, we were 4 years in and just coming from recovery from the pandemic. So nationally, all our commitments, commissioning and normal processes, we didn't fulfil. That didn't matter where you were residing, and as simply as we responded to the moment. So everything shifted into NHS world. We were unable to follow business as usual. So majority of this is around us getting ourselves back in order and that recovery stage. And I'm going to pass to John to provide more detail, but just to keep that in context.
I mean, I know we always talk about COVID, but I do think it had a massive impact. I mean, I think we redirected people to almost act in the hour, in the day, to make sure that people were safe and to make sure vulnerable people actually had the basic services. And I think that did lead to some, I guess, degree of neglect, quite rightly, in terms of some of these documents, etc., and what we're talking about here. I guess the other thing is, a bit like what Chris talked about, there's a lot of change in social care, and it's no different in commissioning. I think we've probably seen a churn of kind of, senior managers and managers across the service, which is, again, kind of disrupted the flow. And I think what we're trying to do here is to make sure that we've got, if you like, that foundation block and consistency to make sure whoever might be leading commissioning or whoever might be working in commissioning, there's a clarity of direction. And there's a way of doing things that actually is embedded. And I think that's the assurance I would give to the committee. It's really important that we've got a set of arrangements and ways of doing things in Haringey that put us in the right place for the future. And again, it really won't matter who the leaders might be. The processes and the ways of working will be so embedded, and that's one of our targets going forward.
Okay, a very quick follow-up on that, and then I've got Councillor Ngharan, and then I've got Helena's hand and Councillor Mason. Yeah. So a very quick back to that. So I completely understand about the COVID. We all sort of realised that there was a huge change that went through that, and that people pulled away. It just did seem to me from the language used, though, that it did seem to suggest that it says like an overall commissioning strategy. I would assume we'd have had one in place prior to COVID. So even if everything went completely to pot during COVID itself, coming out, that we should have been able to go back to the overall commissioning strategy that we had as that foundation. So just to sort of give me a little bit of clarity on that, and then I'll, as I said, my fellow councillors' questions. Thank you.
No, I think that's true. We've got an overall strategy which was a little bit dated and required basically updating quite significantly, because I think COVID changed the way we did things so much, and it was really, really important, when you look at, how it affected communities, we had to commission differently. And I think our kind of market position statement and all those strategies hanging off that market position statement will look very different to what they did back before COVID. And again, I think that's where we want to be in Haringey. We want to be up with the times and ahead of the game, really, and making sure that our direction of travel uses all the money. As Beverly said, it's finite. So that's why commissioning is far too important to just leave to commissioners like me. It's really something, and I guess, listening to colleagues talking about carers in particular, but all client groups, it's about how do we work to make sure that stakeholders get their voice heard. But I think there's got to then be a level of honesty about, what's the challenge and how much money do we have, etc. So, I think there's going to be some interesting conversations, and I think part of that, I think will be with Beverly and Vicky, but also kind of through that commissioning process. So I think one of the things you'll have seen from the report is we've been very honest, and, we can't tackle issues unless we were actually honest about what they might be.
No, thank you very much for that, and that has definitely been noted. So I'm going to go to the councillors that I've suggested, and then Helen as well, obviously, and then I'll look for more hands after that. Thank you.
Thank you, John. Look, I think it's a difficult read, this one. It's very transparent, which is great, very honest, which is good. But I'm sure as leaders of, of this service, after having such a difficult read, your staff would be feeling quite down with a lot of these things there. So morale is a very big factor in the NHS. How do you deliver this service? So I'm going to ask you two questions. One will be critical, and the other one may be a more open question. All right. So the first is around the workforce, and it's the same themes that I've been sitting here for a year now as a relatively new councillor. The issues around silo mentality, poor communication, lack of collaboration. So these are kind of like, for me, quite red signs, basically, which I regularly read. So my critical question to you is, how are you going to actually, next year when we come back, we won't see this type of language, but it actually changed to the workforce is collaborating, the workforce is communicating better, and the workforce is delivering what it is that the residents want. So that's my first sort of critical question to you, how you'd answer the question. Secondly is, Obviously, there's some positives here. And I want to ask as an open question, what's the positive you take from this, and how would you feed that back to your colleagues, to your staff?
I'll tackle the second question first, I think, because actually, you know, there are some challenges in that report, but the one thing that came out very strongly was our strongest asset are our staff. And there's no two ways about it. You know, I mean, I've been working with a team now for almost a year, and they are probably the most responsive, hard-working group of staff that I've worked with for a long time. And bearing in mind, some of those comments came from staff. So I think, you know, there's some messages there in terms of they were keen to ensure that the full picture was actually shared. Because I think, you know, and it's for us to respond then as leaders, but I think that's the other positive for me, is that they were very happy to be very honest and share. I mean, I think what we've got in the team, and I'm talking about that wider commissioning team, is a fairly supportive group of staff, but also a supportive group of managers. So I think those ingredients really bode well for the future. And I'm really confident that, you know, in 6, 12 months particularly time, I would be happily coming back to talk to you about what's happened and maybe bring in some of the staff, because I think they would be finding that quite helpful to just talk about their experience. We've got a lot of things that we've got in the pipeline that we want to do, and, you know, that's with the support of the staff. You know, it's a bit like we don't, you know, I mean, we have to listen to what the service needs are, but we also listen to our staff. You know, we couldn't deliver those services effectively without really good staff. And I think we have a really good foundation block there in terms of who we have at the moment. So although there's some hard-hitting things in there, I think there's a lot of positives, as you say, that come through, you know, for everyone.
I'm just going to come back on the Councillor's question around how are you supporting staff following this report coming out, because although individually some may be incredibly resilient staff, actually the figures and the comments in that may make people feel a little bit, you know, unsure, or, you know, not as well supported as maybe you're thinking they are. I don't know. I don't know how you're measuring that, to be honest. So I think for us, it's just really getting that clarity of how you're supporting the staff at this point. Thanks.
Thanks very much. A really important question. The health and well-being of our staff is paramount. I think there's something for me around the spirit in which I approached this exercise. Very, very much welcomed it. And there's something around having a culture of learning that I think is really, really important. So a real absence of defensiveness. So I'm really pleased that the staff felt they were able to be open around challenges, and also to be able to highlight what was working. And I think it's only when we have that feedback and that foundation, because from where I sit, I may have a different perspective. It's really important to get that bottom-up perspective. That's the only way we can improve. So that transparency, that openness, that honesty is a culture that I absolutely value within the team that I work with. And I'll pass over to Alex, sorry. Only ever met on the screen, first time in person, because she's obviously worked more closely with staff. But I would say, just from that overview, that is the culture that I really welcome within the team. And I think having that openness and then being able to have conversations about how we go forward together is the only way we will learn and develop. Thank you.
Thank you. Just to follow up, I'm Alexandra, and I'm a project manager working with the team. And part of the work that I've been doing is developing the kind of balanced scorecard approach and looking at all the different areas of development. And I would say that, just to reinforce what John and Beverly have said today, is that number one, we're introducing and kind of using the presentation and that, you know, we've shared with you as a way to kind of talk to staff about actually what's the outcome of all of their contributions. And I think being honest about acknowledging where they feel supported in that. And I think leadership has been really key in terms of the way John and our colleague Becky approach staff and talk to staff about what next. And so we have also, I would say, the largest part of the project plan focuses on workforce, and I'm working quite closely with a colleague in our kind of main link in human resources, looking at things as well about how, as we go through change, our staff experiencing that and different tools we can use to help them explore that, measure that, talk about it in supervisions, in team meetings. And so those are the things that are kind of up and coming across that workforce area over the next few months that will be key, not just about kind of tasks and things like that, but actually their experience of this kind of overall transformation that involves also the things around delivering value for money on services, engaging with the community more, and having that foundations and information in place.
Remind me, which councillors were next? So I can't remember whose hands were raised. Was it? Who did I call? Okay, well, in which case I'm going to go from Councillor Donovan and we're just going to go down the line. Is that okay? Thank you.
Okay, thank you. Yes, this report is very honest, and it does look in all areas, and I think that's what we need. So thank you for the report, because in order to move forward we need to know where the position is now, and then we need to take a beat, look at the strategy, and clearly on page 102, 103, 104 you have detailed recommendations looking at what works, what doesn't work, where the building blocks are, how you can build on those foundations. And I suppose you talk, obviously there's recommendations, but then you talk about creating a commissioning development plan. And I suppose the last point is most relevant to us as councillors: put in place the resources needed to implement the commissioning development plan, because this is an area that's so vital. It does need proper resources, and it's something that we need to work towards. Thank you.
Councillor Mason, do you want to ask your question?
Thank you. I suppose one of the things that reading the whole report, and I completely agree with what other councillors have said and you've said about opportunities, and that those things always give you an opportunity to step back and to think, okay, how do we look at this and how do we remedy it? This might sound like a criticism, but it's a question. So one of the things that the thread through this that troubles me a little bit is that it seems that one of the problems is the systems, and whether the systems are working properly to support the workforce, to support the residents and to support everybody else. And it's difficult. Strong systems are hard to put in place and to keep going. I know that. So I don't see that coming through in the report. I can see a lot of care, a lot of thought, a lot of compassion, a lot of support for staff, which is all completely 100% right. Can you honestly tell us that we have got the systems in place to actually deliver the goods for our residents? Because as councillors, that's the thing that we often come across, as people saying, I've been waiting for 6 months for somebody to come along and assess this or do that or blah, blah. And I get the COVID issue, obviously, and the time lag and the problem we've got, but unless we've got the systems to drive that and the reporting to show that the outputs and outcomes are being met, then we still lag in that area, and we'll still get residents who are really dissatisfied with the service. So the question really is, are you confident that we have all the systems in place that we need? And if you're not, that's fine. I'd rather know that you're not confident than to say you're confident and then to have everybody else saying no. So it's just knowing that. Thank you.
Okay, thank you.
Thank you. So are we confident? Absolutely, yes. I am absolutely confident that the right people are in the right roles with the right backing, systems and processes to support the best outcomes for residents. We have had to redesign strategies, policies, processes over the last 9 months to meet the changes within the system. We're about to go to an electronic liquid logic system from Mosaic, that is the service user interface. That's been a massive piece of work, and within that is Controc. So some of these things that we're talking about in here around strategies and different processes and policies will be pulled through in that. So we started the work today around how we're going to design dashboards that come in from commissioning into SMT. So the new systems, electronic systems, are going to deliver far better outcomes for residents at the point of digital contact. So we are digitalising some of our commissioning strategies and putting them into a wider context within corporate. So I am really... Sorry, did you want to come back in again?
Don't mind, sorry. Is that all right, Pippa? Just really quickly. To me, what you're saying is that the systems have been clunky. The systems haven't necessarily been working for the best outcomes, but you're addressing that and you're bringing new systems into place. And I don't think that, to me, there is a time lag there. So personally, I wouldn't say I am absolutely 100% confident all the systems are in place, because you haven't trialled them all yet. So I think I'm hearing the response is, we know the problems, we've put the systems in place, and we're going to be testing them to see that they work. Is that fair?
So the system that's coming in is a national system that is used in many authorities, both the Liquid Logic system and Controc. The difference for Haringey, and a really beneficial supportive, is Controc drives payments and financial assessments. It's new to us. It's not new nationally. So it's really about the ambitions of commissioning in our area, really taking that next step digitally and providing that instant response. So again, I've worked with Liquid Logic, I've worked with Controc, not in Haringey, but in other areas, and it's a fantastic system. So it will draw out those dashboards, and I'm happy to come back in 6 months and just show you what we are learning from that in Haringey and how it's bettered for our residents. But everything will be digitalised at the point of a finger, which we haven't previously had. The next step is to align some of that with other functions, maybe DWP and other areas. But yes, we are really happy, and the support is strengthened for our services within the commissioning arena. And again, I'll say, we're always going to be on learning. We're always going to want to aspire to be better. And that's the rationale for doing the review in the first place, because ultimately we want excellence in Haringey. And we're always going to be really critical of ourselves as well, because that's where we develop and learn and get and improve services for residents.
Okay, thank you. I just know we're a bit tight for time, but I've got Councillor Donovan's question hasn't been gone back to. So I'll just check. Sorry, Councillor Donovan, what was your...
Well, I'm not sure whether it was a question, but I suppose it was the recommendations, the timescale for those, and also the timescale for creating the commissioning development plan.
So, can I just come in the first one? So the electronic Controc system, the switchover is on the 12th of July. So we're already geared up for that. So that's the Controc, the Power BI, which provides the data behind it, and the Liquid Logic function that swaps our resident service user experience. And I'll pass back to John for the other timeframes. Thank you.
I mean, the action plan will fall out of that strategic plan, and we're planning to have that in place. We've said 6 months' time, so that's kind of our target date.
So next in line, Councillor Cathy Brennan, and then I've got Helena. So, and then, yeah, if you ask those two questions.
Okay, so possibly less of a question than a sort of onward and upwards thing. I did notice in the report there seemed to be, because there are a lot of comments about seeming sort of lack of communication, sort of we weren't informed, or it wasn't easily accessible, the relationships are not positive. So what I have said in the past, and what Councillor Lincoln has said, I feel it's really important that we set up that we're much more transparent, or the council is so much more transparent and so much more communication goes on, because I just think that that is going to change everything. And it's not just within the council. Once the council has an ethos of really communicating, it spreads outwards and they'll have the reputation, because at the moment we don't have the reputation in the community of an outward facing. And I want us to be that. That's what I'm saying. I'm very...
Oh, thank you. Helena, your questions? Thank you.
Right. I mean, I hear everything about what's happened to the report. I've got a problem with your recommendations. I don't think they're strong enough at all, especially in the residents and community area. I think they're really weak and I'm disappointed. It's not good enough just to engage with the local community. You should be consulting, you should be co-producing with them. And where is the recommendation that you feed back to them? It's not even there. So, you know, I feel for the residents, that's my job. And I actually am disappointed. I think you've got an opportunity here to really set yourselves up as a council that listens and feeds back and does things. So I'm sorry, I love the work you've done. I don't like that recommendation at all.
Okay, the opportunity now to come back. Vicky.
Noted, and we will absolutely go away and strengthen that particular area to make sure it encompasses that fuller, absolutely. So apologise for that and we'll ensure that we change it. Thank you.
On Councillor Brennan's question. Just around on the sort of communication and being open. Was it communication? We have a reply on Councillor Brennan's one about being an open, outward-facing council and how we're going to be transparent with our residents.
Sorry, we should have said we agree. Sorry, I should have got back to you and just absolutely agreed. Yes, thank you. Yeah, that's the onward journey. Thank you.
Okay, thank you. And Councillor Peacock. Okay, so thank you. So I'm going to ask a couple of questions. I had one around the area, I think it was page 82, and I think mine was resident focused as well. So, and it sort of centres a little bit on Helena's question about how feedback is going to come to residents, because in that list that we get with the average score, there's a significant low score amongst all of the areas. I think it'd be fair to say. I don't know how you score compared to other councils. I know you said you were, you know, looking at being and doing it first, but I think it's difficult for us to judge because we've only got this. We haven't got Islington or Camden. They haven't, as far as I know, done this. So, but I think for me, it was the user and outcome centred. So everyone who engages with the care system is in charge of what they get, and their assessment of whether they got what they needed is the one that counts. And that score was 30 out of 100. So for me, I think that's the bit when I go to my carers, coffee mornings, that sums it up, that, you know, they're engaging with the council, but the council hasn't quite heard what they've asked for, and there's that miscommunication somewhere along the line of, you know, what they should be getting. They're not sure what they should be getting. There's challenges, there's upset, you know, and they need advocates to come and speak. So I think for me, that's the bit that I'm really keen to understand when you go back and strengthening that recommendation that Helena has pointed out, how you're going to really sort of tackle that part, because if that bit doesn't work, then whatever else you put in place, if our residents are still really unhappy, how are we going to really sort of focus in on that? So that's my question.
So just to respond to a couple of your comments, I think in terms of the scoring, I think one thing to keep in mind is that the scoring is on kind of the way the criteria is on page 94, and it actually lends itself to being a bit tough, because really a 75 or above would be like, there are no issues, we are outstanding in this area. And like a 25 to 49 is actually, we need to develop some things, and anything between kind of 50 and 74 is like good. Yeah. So I guess I would just sort of make a comment that although that scores a 30, it's overall based on it's almost like if you think of it as a curve. So I'm not saying, I guess it looks probably, it's not like a percentage, I suppose is what I'm trying to say. In terms of how we plan to engage, we're looking at a different, so I've been personally in contact with Public Voice, and we're looking at different ways to engage and work with people. And one of the things that we've said is actually what we want to do is, when we say engage, it is that co-production, it is that consultation, and getting that right across the whole commissioning cycle. So not just looking at, by the way, we need to recommission this particular contract, but actually once that contract is in place, what's your experience of it? How would you like to support us with quality assuring it and reporting on that? And then at the end, sort of, and then kind of keeping people involved throughout. And so we're doing some work with Public Voice and other colleagues to try and, really work with communities on our co-production and our commissioning engagement across the piece. And the positive thing is that they have come back to us and said, we're really delighted because the people with whom we are working and that we're supporting are really keen to do that. So I think it's going to be really constructive conversations.
So is there an opportunity at this point to, you've gone out for support in this review and getting sort of expertise in this. So admit, absolutely fine, Public Voice. There are other groups and organisations that I'm sure there's a number more that would be really helpful. Is there a way of having that sort of bit more, that maybe one step removed in getting that sort of really objective and very clear set on? Because when we're talking about co-produced pieces, because we haven't yet seen any of these, we haven't had an example of a co-produced piece. And I know that in the council we are talking a lot about co-production, but we haven't necessarily seen a co-produced piece of work yet. So we haven't, as a committee, seen anything that's shown how you've engaged, showed how you keep that cohort with going alongside, and then that feedback. So is there an opportunity here for having support? Because I know there is a lot of work out there in London about how co-production is going to be working well. I noticed Beverly's got her hand up as well, so I don't know who wants to come back in first. Okay.
If that's okay, Chair, sorry. So I suppose I just wanted to highlight there are some works that we've all been involved in, maybe not everybody in this room. I'm looking more at Helena in terms of our attempts to co-produce. I can talk about the Chad Gordon Centre, for example, the work on Osborne Grove. So it's not that there aren't examples. What I want to do is to put this into context. Across London, we actually peer reviewed ourselves. Each local authority did separate from this, but a self-assessment in which co-production was a key sort of a strand. Just across that sector, everybody scored poorly. We had an external facilitator sort of peer reviewing our own self-assessment. So this is not focused on commissioning, but I'm referencing it because it actually pulled out that there are mountains to climb in terms of what we call genuine co-production. And in that review, we were able to evidence what we thought were really good examples. I think what we're saying now, we've got some good examples. Actually, we need to embed this in everything that we do. When we talk about personalized outcomes, that means shifting that power dynamic between the professional and the person with lived experience. If you ask me, do we do that consistently? No, we don't. So there is, I think, for me, this is the one area of the CQC inspection that nationally we've all got to up our game. So I think it's really important just to put that in context. Co-production is not about engagement. It's not about consultation. It's about how you work in partnership, how you shift those power dynamics and actually give over some of that control. That doesn't happen overnight. we're very much on a journey. So I suppose I just wanted to put that in context.
So I think, thank you. Building on that, I think maybe a recommendation from the panel is about the support that we suggest that the council offers, you know, in this area of how we do co-production well, and then how it's embedded. And I'm just wondering if there's an opportunity here for us to look at getting support and ideas like you've done in this review, and how that has you know, highlighted things that, you know, as you said, you've now shown it all, warts and all, and now you're looking to see how that's going to be taken forward. So I'm wondering about whether there's an idea that we should be looking to support that work in sort of suggesting, you know, to yourselves, it's a recommendation to yourselves, and you can bounce back and say no thank you, but about how we sort of look to support that co-production, those co-produced pieces of work, recognising that it is a significant change on how it's been done before. So I'm just looking to my fellow panel members.
Yeah, thank you. Whoops, thanks a lot. And Beverly, thanks a lot for that. I completely agree with you that it's not just about workforce, is it? It's also about the residents, because somebody who is coming to adult social care often comes with feeling like they're in the hands of professionals and therefore wants an absolute decision. They don't want maybe this or maybe that. So part of it's about guiding our residents as well. But I also think the council itself, like the councillors, most people don't understand co-production. I understand it a bit because I've worked with it quite a lot, but I still think that we don't really understand it enough. So some people think it means consultation, whereas other people think it means like the residents are in charge. And actually the truth is the residents don't want to be in charge of all their care because they want professional input, just like we all do when we go to the doctor. I want a doctor to tell me what's wrong, not to say, what do you think, to say, what do you think is wrong, and leave it at that. So it is about us learning the role of the professional in terms of people's lives as well. So when Pippa, you say, yes, we can help, I think we need to be part of the learning as well. So that we know the questions to ask, but that we're learning in tandem with you, and that we don't think that we've suddenly got the answers, because I'm afraid we don't.
I'm going to really be very clear. Thanks, Councillor Mason. I hadn't realised I meant we were going to be helping. I meant that we were going to ask for external support for this area to get extra support in. Not that we as a council, I'm using the royal we there, that the council is going to be doing it. So I was saying it's more about getting people with expertise in to support at this point. So I don't know if that's something that the other panel would think that's a good idea, or whether we, you know, it's not. But I think it's helpful. And Councillor O'Donovan, thank you.
Yeah, I mean, following on from that point, I think this idea of deeper consultation and co-production isn't just happening in Haringey, it's happening throughout London and throughout the country. And I know there's been some academic research and papers produced in relation to how that can work. And do you use those? Do you have access to them? And is it something that maybe we in the council could either commission some academic work if it doesn't already exist that's appropriate in this area? Thank you.
Thanks very much for the question. So I think it's important to note that in my role, I have access to, you know, good practice nationally. Earlier today, I was at a Partners in Care sort of away day, and there was an expert panel by experience who played a leadership role just by telling us their stories and relaying what a good life meant for them. So it wasn't focused on paperwork or assessments, it was focused on outcomes. So TLAP is a well-renowned organisation that's very much at the forefront of personalised outcomes and co-production. We as an organisation, a national organisation, ADAS, we work collaboratively with organisations. So there are lots of learning that I have access to, not just me, other DASs have access to that I have brought back and will continue to bring back to Haringey. And one of the members of the panel actually remembered being part of a peer review we did in Haringey and coming along and actually being part of that peer review. And he spoke about that at the launch. So we're not new in the game. Let me just make that clear. But what I suppose what I want to bring over is it's a massive cultural shift. So it takes time. And absolutely, we will take on board all the resources available to us. There's work with the King's Fund, etc., that we can have access to. And I think it's really important that we continue to build that evidence base about what works. But fundamentally, I think what works is listening to experts by experience, people who actually live the issues that we are trying to work with.
Thanks. So just to be really clear, Beverly, you're saying that actually you feel that through your role, you've got enough support so that you can go on to this journey without us making any further recommendations about getting extra. Okay, so I'm just checking what you're.
That's not what I'm saying.
I just thought I'd clear it up.
Sorry, that was your interpretation. I'm open to any offers of support that will assist us in this journey. I just wanted to make clear to the audience that we're on the sort of the roadmap, and we're not just beginning, but it's challenging, it's complex. It doesn't just happen overnight.
I think just because it's such an area that, and as you've rightly pointed out, that it is difficult. There's a mountain to climb across the whole country. We're not talking Haringey, and we understand that. And I think it's just really about the committee looking at the work that's ahead of you and the support and for staff in that cultural change, and maybe us making recommendations to support that work. But obviously we don't want to tread on anyone's toes. If you've already got that all in place, obviously we're not going to sort of, make anything, add anything to that. But it was just really to understand from yourselves whether you think it'd be helpful for the committee. The second bit was also around when we take this next step of work back, because obviously we've spoken to John today already about some of the commissioning work that you're doing in the localities. I think Councillor Mason brought up around, getting that provision of care locally. So when's the next point that the committee could look at the next iteration of progress within this piece of work that you're undertaking? Thank you.
Thanks very much, Chair. So I'd like to take up the offer of the committee to learn alongside us and residents, as Councillor Mason has highlighted. I think it's also important to involve local councillors. As we work in localities, it's important that we work alongside councillors. You know your communities best. So I think we're all in this learning journey together. Thank you.
Okay.
So I'm noting down people who've so far today have been saying that they would like to be involved. So if you do want to be involved, I'll take your name and email you, and we'll pull together some things. So I think it's really fantastic that you're really enthusiastic and want to help us on our journey and be with us on our journey. Thank you very much.
What was a good time for us to be taking back this piece of work, Vicky?
So we've got 6 months that so about probably 9 months, but I do think we might be able to bring something back around the co-production bit, how we're working, but not the full piece, probably at 6 months point, and then 9 months for the wider piece of where we began, where we're at. Does that sound okay?
I see nods from the committee. So thank you for that, and thank you for your very honest report, and it is appreciated, and it's helpful for us to really understand the issues that have come before us. Any other recommendations from the panel before we close down this item? One last little question for me, though. Would you be repeating the bit where you ask your staff for that very honest appraisal at the next?
Yeah, definitely.
Thought I'd just ask. Thank you. Okay, so thank you very much for coming along this evening. That has been really helpful and informative. I'm going to ask the panel to still remain with us. We've just got to go through the work programme, which Dominic will lead us on, and the panel project that we're doing. So you guys stay in the room, but thank you to everyone for coming in this evening. Thank you.
Sorry, can I just ask a question before our colleagues from Social Services leave? We all got a yellow warning today about extreme heat over the weekend, and there's a significant risk of of ill effects to people. I'm sure the council has it all in hand in terms of supporting people that might be affected.
We're in close contact with all of our providers, and whenever we get kind of alerts about kind of heat wave particularly, or the cold, we immediately make sure that we're kind of checking out that everyone's okay out there.
Thank you very much. Thank you. Right, okay, over to the committee, and Dominic, if you go take us through the work programme once the room is cleared and the tracker.
All right, I'll be quick as I can then.
Everyone, we're still in meeting. Thank you.
So just a note from the work programme update that's in your pack, in the main pack. So the hospital discharge project is continuing. We had a very good session this week with Whittington Hospital and with our sheltered housing team. And we're anticipating starting a second scrutiny review on digitalisation and communications with residents in the autumn. And then also, in fact, then we've got the next meeting. So we've got, so for 18th of September is our next meeting. It'll be one of the first of two sessions with cabinet member sessions with Councillor Desneves. The second one of those will be in February. So this will be the first opportunity for cabinet member questions. We also have updates on the Living Through Lockdown report, and we've also got penciled in an item on suicide prevention and mental health. So if anybody has any suggested changes to the work programme, then let us know now or by email afterwards.
That was very succinct. So just to let you know that the panels project, for the next panels project, obviously not the one we're undertaking at the moment, it was particularly pulled out around communication for the council, how we're communicating with residents. There's a lot of work going on here, which I think would dovetail very nicely in with that around what's going on. So I think that looks quite a strong piece at the moment, but obviously it's open to be rediscussed, thought of, added to, so please just email us and we can have a more in-depth conversation. We usually have a coffee, we usually meet up together and just have a discussion around panels work at the end of the sort of June-July bit before we all break up. So just to let you know, this gives you time to think if there's any other ideas you want to have added in or something separate. I'll finish there unless anyone's got any other questions.
Just a quick one. There's no scrutiny cafe. Scrutiny cafe only happens once, 2 years.
Every 2 years. Yes. Okay. So thank you everyone for attending. Close of meeting. Thank you very much. Thank you.
I just want to know, sorry, Dominic, it's really for you. These three to be allocated, are they likely to be allocated into this year's?
Yes, I think we've obviously there are a few spaces, so it's up to the committee. But yeah, we anticipate being able to get through those. I'm just looking at, I mean, Osborne Grove particularly, we want to follow up, and integrated care system, yeah, definitely. I'm not sure about the pandemic one, but we'll see if we can get the space. But yeah, that's the current intention.
I was literally just going to ask if we are going to have